Inside the stories that affect you. This is Inside KELOLAND.
Good evening, I'm Angela Kennecke. A lot has changed in just 1 week. We are dedicating this week's entire Inside KELOLAND to the COVID-19 pandemic. We're talking with medical professionals from Sanford and Avera about their response to the pandemic. Plus, we're talking with the Secretary of Labor in South Dakota to see what help is available to people who are out of work due to COVID-19. We begin tonight with Dr. Mike Wilde, the Sanford Health Medical Officer. Thank you for being here, Dr. Wilde. We want to begin with talking about how Sanford just recently closed the hospital to visitors and how patients and their families are handling that decision.
Yeah, that's a challenging decision, and anyone who's been in the hospital or had family in the hospital can certainly empathize with some tough discussions that are going on. We've aligned with Avera for the betterment or the protection of the community, hopefully, in trying to limit the number of people that are in and out of the hospital just to protect our staff, protect our patients from potential spread of this illness. And so there's some really challenging discussions going on right now at the front desk. People have done a nice job, for the most part, abiding by that, and we've gotten communication out as well.
Well, we've been asking viewers for their question all week. So this is a question from Buffy, who wants to know if the hospitals in South Dakota have decided to use these drugs for patients with COVID-19, or is it up to the treating physician?
Yeah, that's a good question. Absolutely. You know, this illness has not been around the world for very long. And in that time, we've really been able to maybe look at some treatments that can help. Hydroxychloroquine and azithromycin may have activity against the virus, and so we are absolutely using those. As you know, testing can have a little bit of a delay, so we'll even use them preemptively in patients that we're highly suspicious of, or if we have a positive test, we do use them in the hospital. We're asking not to use those in clinic and try to preserve those for hospital use, and there's some other medications that we're using as well in research if that's felt to be indicated.
Are there any unwanted side effects to those drugs, Dr. Wilde? Or are you also, maybe a second part of this question, are you worried about people hoarding them?
I'll answer the second part first. So yeah, we are a little concerned about hoarding. There's been instruction from boards of pharmacy and state medical boards across the nation in regard to that. In regard to side effects, there's some long-term side effects if you use these medications for a long time. For instance, hydroxychloroquine can be used against diseases like rheumatoid arthritis or lupus. And so we have quite a bit of experience with it. In a short term, there's minimal side effects. They're actually quite safe. It can lead to potentially some heart rhythm issues, but that's part of the process when we start these medications. We make sure that you're not susceptible to that from a heart rhythm standpoint.
And I'm guessing you'll know how effective these drugs are the longer this goes on and the more often they're being used in patients against COVID.
Yeah, and that's, you know, I keep saying flattening the curve. Everyone's talking about flattening the curve, slowing the spread, because the slower the spread, the flatter the curve, the more time we have to mount a proper response. And that's really what everyone needs to help us with, and it's much appreciated.
We've had a couple of questions from viewers about CPAP machines. Now, Julie wants to know if they can help bridge the gap if there are too few ventilators out there.
It's possible, and we do absolutely use CPAP or BiPAP. We try to minimize ventilator use just in any patients, not necessarily COVID patients, and so we use CPAP and BiPAP quite a bit. Just ironically, the University of Washington, I know, is working with programming CPAPs and BiPAPs to actually be used as ventilators or as they run out of ventilators, and so that's an option as well.
Well, there are a lot of those CPAP machines out there in people's homes, so that could be one option for people if there is a ventilator shortage. Now, right now, you have enough ventilators.
Right now, everything we're looking at, we're doing just fine. And again, another call to flatten the curve.
Let's take a question from another viewer, Sasha. Once you get the virus, are you likely to get it again if you work in the healthcare system?
Yeah, good question. The quick theoretic answer is no, and that's our hope. time will tell on that, but theoretically you should be able to generate an immunity and not get this again. I'll just go ahead and preface that or follow that up by saying it's too early to tell. We're getting people through the illness, and over time we'll learn if they truly develop immunity to it or not.
Yeah, I know the question is really out there still in China, if you can get it for a second time or how then that immunity lasts. So it is something I think nobody really has a complete answer to. Now, Lori wants to know, if a doctor does the swab test and the sample sends in to 24 to 48 hours or longer, or if it sits there in the test tube, is that still going to be accurate? So how long from the time the test is taken till the test actually occurs?
Yeah, it's a good question, taxing my information here a little bit, so which makes it an even better question. My understanding is when the test is taken, it's in a cotton swab, and it's a nose sample, and that swab lives in a media, and I don't know how long that media lasts, but I would, from what I'm hearing, at least 72 hours it can hang out in there, so 24 to 48 would be fine.
Okay. Well, thank you so much, Dr. Wilde, for joining us today and answering our viewer questions. After the break, we talk with Avera about its response to the COVID-19 pandemic. Inside KELOLAND, we'll be right back. Welcome back. I also spoke with Avera's chief nursing officer just a couple of days ago about how testing is going for them and its decision to close the hospital to visitors. One of the things that we're seeing, especially in New York, but in other metropolitan areas, is the lack of safety equipment for medical personnel, the tax on the hospital system just having to handle so many patients, the lack of ventilators available. I saw in New York City nurses wearing and nursing assistants wearing garbage bags. I mean, are you worried about not having enough supplies to protect your staff and to treat patients?
You know, we are working very, very closely with our supply chain across the Avera enterprise. And so that is something that we have been very well aware of in terms of something that's critical to pay attention to. So certainly a concern that we have, and really I would say that's one of the very first things that we've started to put a lot of time, effort, and energy around, because our commitment is to keep our teams safe, our patients safe, and our community safe. And that is a huge part of that. So great question, lots of work going into that in terms of making sure we have the supplies and the equipment that we need and using it in the most resourceful and efficient manner possible.
What are you doing, what steps are you taking to protect employees and the public?
Yeah, great question. We're taking many steps. Number one, and this ties back a little bit to the subject matter that you just mentioned in terms of protected equipment, Avera stopped doing our elective non-essential surgeries over a week ago. And that really was done as a way to say we need to conserve our equipment, our gowns, our masks, our gloves, all those sorts of different things so that we can keep our folks safe. Other things that we're doing is really working hard to educate folks. As you can imagine, as emotions escalate and, as you mentioned, hearing on different news media outlets and such, there's a lot of panic, a lot of drama that comes out of a situation like this. And so educating not only our internal teams, but educating our communities and our patients and families. Additionally, we've taken steps like moving forward with no visitors. And that has been, I can tell you, an incredibly difficult step for us. We're in the caring profession. We are used to supporting patients and families with their visitors. And so that's been a hard step, but it's been the right step in terms of really protecting and limiting traffic flow in and out of the organization that isn't absolutely necessary for the operations.
What do you say to people who are worried about their loved ones who are in the hospital for very necessary reasons? Are you going to set up, maybe like we're doing a video interview right now? Is that a possibility down the line? And what about people having babies? So this is maybe a two-part question. People who are going in and having babies, are they allowed to have someone in with them?
Yes, great questions. In regard to how we're trying to connect with our families, we have a number of different things that we are working through. First of all, as you mentioned, we're doing a video interview, and so we know that there are a number of people who have Skype abilities, FaceTime abilities, different technology options to connect, and so we are certainly working hard to support that for the patient and family. We also, as an organization, for some time now in our surgery area, have had an app that we use to update patients, or excuse me, to update families in how surgery is progressing. And it's actually a texting app. And the beautiful thing about it is it's secure, and it can update the son in California or the daughter on the East Coast with how the surgery is going, how their loved one is doing. It is one-way communication in terms of the languaging, but they have an opportunity to respond back with an emoji, a limited number of emojis. And we have already seen great success in our surgery area. So that's something that we are right now in the process of launching in our critical care unit and in our COVID-19 unit, where we have cohorted our patients that are being ruled out for that. So really trying to, as Avera has done historically, leverage technology and make that work, because we do understand it's very difficult for families to not be side by side with their loved ones that are in the hospital. In regards to in OB, where folks are having babies, that is one of the areas of critical exception. So the mom delivering the baby is able to have her support person with her.
I know that Avera's very focused on behavioral health. It is one of your specialty areas. Are you seeing an increased demand because of the stress and anxiety, depression, and everything else, worry, fear that goes along with this?
Yes, Avera is very well aware of the situations of panic attacks, anxiety, stress that are related to this current situation. We have free mental health assessments by trained counselors that are available 24/7 through a phone call. And really want to stress to folks that if that is something that you're experiencing, please reach out. We are able to get you set up with either an in-person or, during these times, certainly a virtual appointment with a counselor that can help work through some of that. Because we are really seeing that, and I would liken it a bit back to the farm stress hotline. Mm-hmm. We are really, really seeing the need to focus on this pandemic and the stress and anxiety related to it in a very particular way. So we are currently actually working on a specific hotline that would be related to this exact topic.
And what about testing? We know that both health systems in the Sioux Falls community are now doing their own testing for COVID-19. How's that going over at Avera? Do you have a lot of tests available? Are you testing a lot of people?
Yeah, testing is going well at Avera. We're very excited about the opportunity to have that testing within the health system. We are testing about, I would say, between 100 to 200 people a day. I'm really proud of the fact that that testing process is very well orchestrated. So meaning that there's a call center that you call if you feel like you are having symptoms of COVID-19, or certainly you can call your primary care provider. And then there's triaging done that eventually lands in the point of you should go in and be tested. And then there is a drive up that, again, only folks who have been directed to go there can be tested. And then that test is ran locally now. And results are really around the 8 to 12 hour turnaround time, which is a huge impact in a positive manner compared to what we were dealing with before. And so again, just very thankful to have that available here, and it is going very well.
All right, well, I really appreciate you taking the time to join us today. Well, this pandemic has also forced many people out of a job. We talk with the Labor Secretary about how you can file for an unemployment claim next. This pandemic has forced many businesses to close or reduce hours for its employees. That means the Labor Department is seeing a surge of unemployment claims. I spoke with the Labor Secretary earlier this week to see what help is available. Marcia, I know you've been Labor Secretary in South Dakota for 5 years. Have you ever seen anything like what we're seeing now?
No, this is unprecedented, so it is a brand new situation for all of us.
I read that we were at a half-century low for unemployment in February, and now the latest numbers were something like 3.3 million Americans had filed for unemployment. I'm guessing that's everywhere, including South Dakota.
You are correct, Angela, and in fact, we just saw the numbers for the first time this morning as well. They were released. I think for the week, last week, our claims were at 169 claims for the week. The number released today was 1,703 claims for last week.
So you went from 169 claims to more than 1,000?
Correct.
Wow. And there's so many people that aren't even eligible for unemployment.
Well, times are a little bit different. Many people that are not typically eligible are eligible now.
Who would that be? Who would that be?
School employees, for instance, that may be laid off because the schools can't keep their hourly employees on, substitute teachers. In the hospitality industry, we've just had so many layoffs that are related to COVID-19, and so that has opened up the eligibility for those individuals.
How do you handle that sudden influx of claims?
We are literally, you can probably hear our phones ringing in the background. We have added staff in our Aberdeen Center, and everybody we're adding is internal because those are the people that we can train the most rapidly and get them up to speed so everyone can help to take claims.
Where's the money going to come from to handle all those claims?
The federal government, as we speak, is acting on legislation. Some legislation has already been passed, so there will be some funding coming from the federal government to help not only with the administration of those claims, but for helping offset the cost of the claims.
I know it's hard to speculate, but this really does seem like just the start of all of this. Are you prepared to handle an even larger influx of claims?
Yes, again, we're working on that as we speak. It's literally every hand on deck, and we're looking at how we can expand capacity. Tomorrow we'll be getting additional phone lines to our call center. The biggest thing the public can do to help us is to file online.
What are the most common questions that you're getting from workers right now, or even small business owners?
The most common from workers is, how do I file? A lot of people do get frustrated. They call the phone number. They may have a wait time of an hour and a half. And so that's why we're encouraging them to file online. That's the quickest way. They need to have their driver's license, their social security number, and their work history for the past 18 months. That really speeds things up. From small business owners, I've actually been answering the phone when I can the last few days. So if somebody calls, they might get me. And what I've been telling small business owners, it's a business decision they have to make. They're really concerned about their workers and want to do right by them. And so we've been talking through some of the processes on how they can help facilitate and do what's best.
I know we talked about some workers that maybe wouldn't have been eligible in the past, but there are still people out there, like small business owners, entrepreneurs, who aren't eligible for unemployment benefits.
Correct, and stay tuned to what's happening at the national level. I think the Senate voted on a bill last night. The House is supposed to vote on it tomorrow. But there are actually some exceptions in that legislation, I think, that are going to deal with small business owners potentially, and even independent contractors.
Let's talk about filling the jobs that are out there now, because suddenly we have a huge influx of jobs in the service area, like Walmart hiring hundreds of people, grocery stores, those kinds of things. What are you seeing?
We're trying to track that because we definitely people that want to get to work, and there are people that do. They're anxious to have that paycheck. So at the local level, I have my job service offices reaching out to their local employers. Any business they hear of that's hiring, we're trying to get that information out to the public. And we have our our online resource for searching for jobs. So we encourage people to use that right now. But there are definitely some sectors that are still in a hiring mode.
Yeah. Who do you think is hiring the most? Do you have the largest employer out there that's hiring more than others?
I think 3M, obviously, we hear about all the work that they're doing 24 hours a day. An industry like that, manufacturing like that, there's definitely potential. You mentioned the Costco's, the Walmarts, the grocery stores that are trying to keep our food supply chain intact and provide those services.
Do you talk to people who are somewhat panicked over how can unemployment really help them meet all of their bills? Because it doesn't completely replace what you were making most times.
Correct. The maximum benefit is $414 a week. And on average, roughly somebody's going to get 50% of what their weekly wage was before, up to that max. So it is a partial wage replacement. Personally, I have not talked to anybody that's panicked. The public has been very understanding. They know that our phone lines are swamped. When they do get to talk to a person, they're so thankful and appreciative. We've received lots of compliments from the public for the work that our UI call center is doing. They were called angels in disguise yesterday. So I think the public is really sensitive. So personally, I've not experienced that sense of panic.
Well, that's great. Any other advice you have for people who maybe just got laid off or maybe will be getting laid off in the coming weeks?
Be patient, file online. Don't panic if you don't get your claim filed right away in the week, because we can backdate things. And just typically Monday and Tuesdays are those really high call volume days. So if you can wait a little bit later in the week, then we'll be able to get to your claim. And like I said, it's backdated, so it's not impacted you negatively.
You know, I've done a lot of business and economic reporting over the years, and I've always reported on our extremely low unemployment rate in South Dakota. Even during the recession, we had enviable unemployment rates. Do you think that will continue during this time? I'm asking you to be a little bit of a forecaster here, but compared with the rest of the nation, do you think we'll see the levels of unemployment the rest of the nation is seeing?
Again, it's pure speculation because we have nothing that we compare this to. It's brand new territory. I think our recovery will be fairly quick. I think we're going to have that pent-up demand. I hope that we're putting things into place that our small businesses can survive, and that second that we can get out and function as normal, that we're all going to be more than ready to do that, and things will rebound fairly quickly.
Well, thank you so much for joining us today. We really appreciate the insight.
Thank you for the opportunity. The news media has been a great resource in helping us get information out to individuals impacted, so they know how to file, so they know what their options are. And basically, we're telling people, file right now, and we'll figure out that eligibility as we go through the process.
And do that online. We're going to put the resources for you on KELOLAND.com. Stay with us. We're back right after this. That is all the time we have for this week's Inside KELOLAND. To stay up to date on the spread of COVID-19 in South Dakota, just head to our special coronavirus page on KELOLAND.com. While you're there, you can also find out how to file for unemployment claims online. And you can also find live coverage of daily briefings from the state and the city and all of our latest stories on COVID-19. Thank you so much for joining us. Have a good night and stay healthy and safe.